Break down what happened last Friday with the health care plan, because lots of things have developed since then.
The Dan York State of Mind program is brought to you in part by Lookout Rhode Island and Takeo Comfort Solutions.
Well, at least the tone of the president has changed in just kind of a 3 or 4 day period of time. We went from exploding, imploding health care to, yeah, we can all get together and fix it. It's hard to follow the bouncing ball, don't you think? But John Friedman will help us out tonight. He is back to explain his understanding of the American Health Care Act versus the Affordable Care Act. We'll try to keep the word Obamacare out of the conversation, although it's kind of, I think, instrumental in the negative politics of the entire thing. Great to have you aboard on this Thursday evening. Let's jump to the rundown and just check on a couple things that are going on. This is kind of a funky deal. A handful of mayors went down to Washington to talk about security and relationships with ICE and illegal immigration. In the meantime, the Bristol County Sheriff got into it. So there's a headline that talks about the mayors getting a chance to give the Homeland Security Chief Kelly a big earful, and then Sheriff Hodgson got into the whole situation. Listen to what he had to say.
These sanctuary cities are going to harbor and conceal criminally illegal aliens from ICE, which is in direct violation of Title 8 of the U.S. Code. Federal arrest warrants should be issued for their elected officials.
Yeah, no, I'm not exactly sure what the sheriff is doing. Honestly, I don't know of at least a New England city, you know, his home base, Bristol County, Mass, that are in direct conflict with ICE activity. Even in the city of Providence, where no doubt the mayor has made immigration a clarion political call, it's been a lot of rhetoric on one side, a lot of rhetoric on the other side, but the actual implementation of getting people deported who are committing crimes under illegal status is pretty much status quo. In other words, the city of Providence has a disposition, both on the law enforcement side and the political side, that, yeah, they're not making their law enforcement officers, meaning their cops, ICE officials. They're not out knocking on doors finding out who's legal and who's illegal. However, if somebody commits a crime and their status is of illegal nature, they are immediately reported to ICE, which is exactly what should be happening and really is what the president is calling for right now. So I'm not sure what the sheriff in Bristol County is doing. We're going to invite him on to talk about his message. He's a terrific marketer of his political position, and he has volunteered his staff to be more active with ICE officials, well past what the city of Providence or the city of Boston are doing, no doubt. But there's a lot of noise, but there's not really a lot of conflict, if that makes any sense. In the meantime, Mayor Lorza was down there in Washington, and I don't know, kind of explains what he's thinking down there.
It doesn't make any of us safer. In fact, it makes it much more difficult to provide public safety if people are laying below the radar and they're afraid to come out, report crimes, and to report, as witnesses of crimes. So we're hearing incidents of these, we're cataloging them, and we'll be sending this directly to the secretary so that they take this into account.
All right, so what he's suggesting is, that the rhetoric and the executive orders and the peripheral vibe coming out of Washington is hurting the effort to find people who are breaking the law who happen to be illegal. It's messy. Again, trying to get the rhetoric out of the way and see what the real distinctions are between what the Trump administration is doing and what local law enforcement is doing, at least in the Northeast region, and you won't find much. In the meantime, Ivanka is hired. She is now a formal member of the White House staff, yet she won't be taking any dough. What she was doing was kind of hanging around with an office on a voluntary basis, and there was a lot of concern about conflict of interest and blah, blah, blah. And so now she will have to subscribe and adhere to all the federal regulations of an employee at the White House while she takes no money in terms of her own brand and trying to, make a profit through her own work at the White House. Everything regarding her business stuff is now in a trust, and, new projects have to be reviewed by one of her family members. I think it's a brother-in-law and sister-in-law who are now handling that aspect of the business. Look, don't be fooled. I mean, the Trump administration is not going to be exempt from its business operations, no matter how much legal paperwork is shoved in between them and the business. It's just not the way it's going to be. It's something that we all knew as voters would be part of the deal, and so I wouldn't get our collective panties in a bundle over the whole situation anyway. Ivanka Trump at the White House is the least of the controversies that Donald Trump has to deal with right now. However, you know, conflict of interest and Russian intervention in the election and all those things still have to be meted out, and there will be some messy crossover now that the Senate is involved in the intel interrogation as well. We'll follow that next week. In the meantime, let's get to the core issue here, what we're here to discuss, and that is what happened last Friday. This is a news story that ran previously, but it recaps exactly what happened last Friday. I think you ought to take a couple of notes and then listen intently to what our guest has to say.
We were very close. It was a very, very tight margin.
From the White House, President Trump conceded Friday his effort to repeal and replace Obamacare was dead, a stinging loss despite his dire predictions.
I want great health care for the people of this nation, but it can't do well. It's imploding and soon will explode, and it's not going to be pretty. I think the losers are Nancy Pelosi and Chuck Schumer, because now they own Obamacare. They own it. I alone can fix it.
It's a far cry from one of his cornerstone themes during the presidential campaign.
And we are going to repeal and replace horrible, disastrous Obamacare.
Which he repeated earlier this month in Tennessee.
Your senators just told me that in your state, you're down to practically no insurers. You can have nobody.
Obamacare is the law of the land, and we're going to be living with Obamacare for the foreseeable future.
Instead of holding the vote as expected Friday afternoon, House Speaker Paul Ryan explained the GOP's collective fail in finding consensus.
I will not sugarcoat this. This is a disappointing day for us.
Ryan suggested the bill be pulled when he knew the conservative Freedom Caucus had not been convinced by additional White House concessions. Still, Mr. Trump said he does not blame the members of the Freedom Caucus.
No, I'm not betrayed. They're friends of mine. I'm disappointed because we could have had it.
Some conservatives opposed the bill because it didn't go far enough in repealing Obamacare, while moderate Republicans say it went too far and could leave 24 million Americans without insurance over the next decade. The president, who acknowledged he didn't like parts of the American Health Care Act, suggested he is now open to negotiating on reform with the opposition.
I honestly believe the Democrats will come to us and say, look, let's get together and get a great health care bill or plan.
Well, you know, there's no doubt that the president was all over the map on Friday, and the map has just been crisscrossed about 3 or 4 different times over the course of this week. Professor Friedman is back. He's a guy that can bring you an economic viewpoint, has worked in Washington, had a little bit of dabble in the Obamacare project after it was first conceived, professor of public affairs as well at Brown University, and was kind of my right-hand guy in live time on the radio, weekdays 3 to 6 on WPRO last week, as this whole thing was crumbling. That was some day, wasn't it?
It was pretty dramatic as public policy goes.
That's true. I mean, public policy is not necessarily dramatic, but we had, you know, we had a drama-filled day because the vote was being brought to a head, and it was a day past the anniversary of the signing, the 7-year anniversary of the signing of the Affordable Care Act, Obamacare. But it was very much an artificial deadline that the Republicans put on themselves to shake things up.
Well, so I actually thought at that time that it was a relatively smart move because these things always take down to the deadline. That's the way these political negotiations go. So at least you can try to get through it and get over it and get on to the next thing. But what we've seen now in the past few days is that there are negotiations to reopen the health care bill. First it was the Democrats' fault. This morning the president is tweeting about how the Freedom Caucus had better get on the team, otherwise they're not going to get anything done and they're all going to get booted out of office. It seems like they just can't let this failure go.
Why did it fail?
So I think there were 2 reasons that it failed. One is that they had a bad process. They didn't consult with their members. They didn't consult with the broader community. And so when they tried to suddenly release the bill and cram it through, people really weren't happy with that. But then in addition, you can fix the bad process. It was also just bad policy. They were throwing 24 million people off of insurance. This was a very unpopular law. It was down to 17% approval under one poll. And at the end of the day, they were making what were relatively minor tweaks in insurance regulations to give about a $600 billion tax cut to rich people by taking health care away from a bunch of poor people. And that's just not something that I think is going to fly very fast in this environment.
The advantage to the rich was specifically what?
So there were a number of taxes that were put in as part of Obamacare that were going to be repealed as part of the American Health Care Act. And those taxes were extending the Medicare tax to capital gains and dividend income for people making over, I think, $250,000 a year, and then also adding about another percentage point to the standard Medicare tax on wages earned over about $350,000 or something like that. So they also repealed a bunch of taxes like the devices tax, but a bunch of the taxes were focused really on this very wealthy segment. And the way they financed that repeal was to take health care away from all these poor individuals.
All right, we'll come back. We'll talk about the politics of this because the speaker is freaking out about actual bipartisan effort, which is kind of different than the message the president is talking about. Stay with us.
What I worry about, Nora, is that if we don't do this, then he'll just go work with Democrats to try and change Obamacare, and that's not gonna. That's hardly a conservative thing. This is a can-do president who's a business guy who wants to get things done, and I know that he wants to get things done with the Republican Congress. But if this Republican Congress allows the perfect to be the enemy of the good, I worry will push the president into working with Democrats. He's been suggesting that as much.
This is a fascinating thing with Paul Ryan. That's earlier today on CBS. He's worried that the president will actually cross the aisle and work with Democrats. I don't think the president really cares who he's working with. He wants to get this thing off the table. And today he tweeted, going after the Freedom Caucus, which is the same group that Paul Ryan is concerned about, trying to tidy up the Republican message so that they can produce their own piece of repeal and replace legislation. When most Americans, I think, just want what doesn't work with Obamacare to be improved, and that's only going to take some Democrats being somewhat objective about the legislation and digging into it. I don't know what he's doing. This notion of, oh my gosh, we might have Democrats involved in this, that's a terrible optic.
Well, certainly if the president is excited about involving Democrats in the process, that would be news to the Democrats because there doesn't seem to have been any serious outreach as part of the process so far.
Because he trusted that Paul Ryan could get this thing done exclusively with Republicans.
Well, that seemed to be the strategy. Now, Democrats all along have agreed that there are ways in which Obamacare can be improved. There are ways in which the marketplace could function better. But in order to cooperate with somebody to fix the marketplace, you have to have a shared understanding of what the problems that you're going to fix are and what the strategy is going to be. And I think the Republicans and the Democrats are very, very far apart on that, at least so far.
Yeah, I mean, it's hard to follow the bouncing ball when it comes to the president. The president more or less said, listen, I'm going to let it implode on Friday. Interchangeable, well, is verbs or adjectives? I guess verbs. We have a headline here. Well, there's last week, and we have a new headline. No doubt he'll make a deal. Well, the deal has got to be made across party lines if a deal is to be made. There doesn't seem to be any underlying philosophical, ideological policy principle that the president is operating on with this health care plan.
Well, it seemed that the unifying principle behind the president's plan was just that they wanted to repeal Obamacare because that was something that was very popular among his base. And I think only recently did the news break that they weren't just going to be able to repeal it, that they were actually going to have to replace it with something, because lots of people who got health care through the Affordable Care Act turned out to really like the health care that they got. And it could be cheaper, it could be better in a couple ways, but fundamentally they were better off now than they were before. And so trying to craft a replacement plan in just a few months I think has not gone so well, and I think they're scrambling right now to figure out what to do.
Well, there's no overriding principle that I can see is driving the notion of repeal and replace other than to repeal and replace.
Right. That's right.
I mean, you've got to have a mission other than just to do something different than the other guy did. And that's seemingly what's missing here.
Well, I think that the current strategy was mostly about getting as close to a repeal as possible and just leaving a few of the things in place from the Affordable Care Act in order to satisfy popular demand for things like pre-existing conditions.
Kids to 26.
Right, but I think if you continue along that line, the type of thing that they were negotiating at the very end last week was exactly removing the ban on discriminating on pre-existing conditions, because they had already removed the ban on essential health benefits, and those two things kind of go together. And so I think in order to really get something passed that people are going to be happy with, you're going to have to abandon this kind of let's get as close to repeal as possible and actually try to think seriously about a replacement plan that's going to satisfy the public.
The conservative Freedom Caucus types, arch conservative if you will, were the late architects of some of these pullaways, for some of these takebacks. Their argument was that it was going to reduce premiums. Well, I would imagine if insurance companies have less to worry about in terms of coverage, that costs can go down. At the same time, Americans, they want the coverage.
Well, that's right. In the Congressional Budget Office, when they projected what would happen under the American Health Care Act, what they found was exactly this. Premiums would fall, but only because the quality of the insurance was falling also.
But they didn't even score the late batch of changes made by the Freedom Caucus.
Yeah, that would make this problem even worse. On an apples-to-apples comparison, premiums were actually going to go up faster under the new American Health Care Act than they were projected to do so under the Affordable Care Act.
We talked about this, the politics of this, and the last time you were here and on the radio. I just keep thinking, I hate to go back to something that seems so simple, but if this plan wasn't called Obamacare, I think there'd be a lot of heat out of the kitchen.
Well, I think there would be, but you know what you've seen is that this law has never been more popular than in the last month. And as soon as people were actually threatened with losing all of the benefits that they gained under the Affordable Care Act, suddenly now more than half the country approves, and disapproval rates are falling. And so I think there's nothing that concentrates the mind quite so much as the threat of losing what you have in hand. And again, I think it can be made better. It can be made to work more efficiently in some places, but it's hard. It's a hard row to hoe what they're going right now.
Specifically, what can be made better? I mean, clearly there are states that are hanging on to single providers right now, meaning insurers. That has been a wobbling situation, one that needs to be identified and fixed.
Right, so that's a great example, and I think that there are two different situations that you see when you have a reducing number of insurers. So in the first case, the free market is working in exactly the way you would hope, where as prices and premiums are going up, as some insurers drop out, it's now attracting other insurers in because the prices are now high enough that they realize they can make a pretty good profit. And so I think in some areas, this is going to fix itself over time. In other areas where I think they're having more serious problems is in rural areas. And rural areas have always been a little bit of the soft underbelly of the American healthcare system just because it's really expensive to cover people when they're not living together. It's hard to get doctors to agree to go work in these areas, and insurance is no different. And so I think that trying to find some special provision to support not just docs living in these areas, but the provision of insurance in these areas would really go a long way.
Insurance for the insurer.
Well, so that's one way to go. It's to limit the losses that the insurers can face. I think that was more of a problem at the beginning of the American healthcare marketplaces, where there was a great deal of uncertainty about what the whole thing would look like. We've now got 2 or 3 years worth of data on what all the claims look like, on how to identify people who are going to be sick and people who are going to be healthy, where there's a little bit more certainty in the marketplace now. But I think people still just are not willing to, in some of these rural areas, go out there and offer coverage, and that's something that clearly needs to be fixed to make good on the promise for affordable health care for all.
Well, there's some budget cuts are also coming down the pike. It's kind of a different conversation. We'll touch base on that. We can talk about this health care plan all night long. It's that complicated and that important, but we'll be taking a breather because nothing's happening yet. We'll be right back. So in addition to healthcare, there's a whole bunch of real serious financial conversation coming down the pike here. We'll put up some notes here that Professor Friedman brought to us. Budget cuts proposed, $26 million to help 30,000 poor families in Rhode Island heat their homes.
So the Trump budget has proposed to reallocate a whole bunch of money away from domestic spending to increase military spending. And I think reasonable people can differ on the right way to spend our money, but I think it's very important to understand the real trade-offs that are involved. They're not just cutting money that's spent in some way that nobody gets any benefit from. For example, they're cutting about $3 billion from a program called LIHEAP, the Low Income Home Energy Assistance Program, which helps poor families heat their homes through the winter. And that's going to affect about 30,000 families right here in Rhode Island. Another example is they're cutting something called the Community Development Block Grants. And those are money given to states to spend as they see fit to help develop public housing, economic development, and other public services like Meals on Wheels. And what's so inconsistent here is that on the one hand, they say that these funds, they're not being used in a good way, but these are block grants being given to the states to spend as they see fit. And yet on the other hand, they always talk about how they don't want the federal government involved in how these monies are spent, how we need to give states more freedom. And so it seems like this really isn't a consistent principle. They're just using this as an excuse to cut money from places where they don't want to spend money. And then they're using the flip side to just spend money in other ways.
And then some of the thinking has not been very deep. And we had the professor on earlier this week talking about the Meals on Wheels program, that it actually saves money in the long run on nursing homes and all that kind of thing. So the dive has not necessarily been done. But these are proposals. At the end of the day, we're not going to see this kind of slam bam.
You know, I agree that you're right, but I think that I've heard Tom Perez say this, budgets are moral documents. This is the first time that the president has actually had to write down his proposals in a way that actually have to add up. When you're on the campaign trail, you can say that you want to do 100 things, and that's great. But the proposals actually have to add up here, and we get to see when you're faced with that constraint, where do you want to put your money? And so I think the fact that he wants to cut all this money from these community support services is very telling.
Well, what do you think now? We've got about 30 seconds here. What do you think now is going to be the priority? The budget's got to get done, so that will go through its normal arguments. Will tax cuts supersede now? They wanted to do that after changes to the Health Care Act because they thought that was a stepping stone toward.
Well, certainly
Now what?
all the public talk was about pivoting to tax reform now that healthcare seemed to have failed, but now they're talking about reopening negotiations on healthcare. Certainly, they're very excited about getting tax reform done, and so I'd be surprised if there weren't a very serious effort on that over the next 6 to 12 months.
Does Paul Ryan run that ship, or is it more of a Senate drive now?
So is a big competition for who gets to be in charge. Sean Spicer said the other day that the White House is driving this train, and I don't think too many people on the Hill were happy to hear that.
Lots of insight. Thanks, Professor. Final word and we come back. Big show tomorrow night, too. Tell you about it. It's definitely a complicating process to transition to a new administration, a new presidency, but there's no doubt in my mind that Donald Trump and his team have made this process even more complicated. Who's actually going to be driving the ship on the changes that he says he's going to make America great with, or is still anybody's guess? It might be that the Senate actually starts to take some strong hold here. They're not the traditional place where legislation, at least when it comes to finances, is generated. But right now, the House is 0 for a big one when it comes to the health care plan. No doubt about that. All right, coming up on the Friday program, that's tomorrow night, Coach Hurley. I guess he's getting a new deal. That sounds like a good idea to me. They finally made it to the dance after 19 years. We'll celebrate that and look to the future for the URI Rams. We'll see you then. See you on the radio, too, at 3 on WPRO. Good night.